Good day, my name is J-Rafael. So, this time, we will discuss to you about the caring for the pediatric patient. So, the intended learning outcomes or demonstrate the case to caring for a pediatric patient. Second, explain how differences in the age of a child can determine how he or she understands illness. Third, explain methods available to ease the pain of venipuncture in a child. Fourth, demonstrate distractions techniques for a child. Fifth, understand the procedure for collecting blood from the dorsal vein. Sixth, demonstrate how properly restrain a child. Phlebotomist's duty not only performing pediatric phlebotomy but also to explain correctly the every details of the procedure in order to make the patient more comfortable. The patient's comfort is one of the importance to do before, during, and after of the procedure. Having a good or calm voice and gentle actions can help the patients more comfortable. We all know that children can detect the emotions and tenderness in our face and body. Explain the procedures even if the child is infant. Younger children may not be able to talk but they know what we are talking about. If the procedures will start, it is good if the child will not see the needle. Having a good posture and voice can help the procedure to make it perfect and successful. So today, I will discuss to you a child understanding of illness. So, as children age growing, so does their understanding of why they are sick or having an illness. The following that I discuss to you is a breakdown by age of children's understanding of illness. The first 2 years, they have limited understanding of illness beyond being sick. They feel stress due to separation from familiar caregivers and changes in home routine. So this age is their knowledge is limited. They don't know about the overall meaning of illness and why they having a sick. And next is the ages 2 to 6 years. Magical thinking creates misconceptions and fantasies. Medical care may be viewed as punishment for bad behavior. Internal organs parts are difficult to understand. Medical play is optimal for illness, education, and medical procedures. So these ages 2 to 6 years, ages where the kids creates a fantasies on their mind and they do not have the knowledge about the procedures of health. And next is 6 to 9 years. They understand some mechanics of health. Concern of death are more prevalent. They can understand how procedures and medication help the body fight diseases and infection and lead to a cure. Medical play and body drawing are useful tools for education and coping. They still have some misconceptions and fantasies. So these ages 6 to 9 years they are now understand some mechanics of health and how it works and the routine of the health and what are the procedures and treatment helps the body fight any diseases. But they still have the magical thinking that creates misconceptions and fantasies in their mind. Lastly is the ages 10 and older. So they have a fairly clear understanding of what illness is and can explain why they do not feel well. So these ages 10 and older they have the full knowledge to clearly understand what happened to them and why they are not feeling well. Next is psychosocial needs of pediatric patients. So what is psychosocial? It is when the young children exhibit this behavior when they are exposed of both social and psychological behavior. When children having a sick, their behavior may change. So, ang bata, pag makaramdam sila og sakit or lain sa ilang lawas, kay mulay jud lang behavior, na uban nga magsad, na uban nga masuko, na uban nga na uban nga malain sila sa laing tao nga ma-expose nila. And there are some children become sad and can't perform other activities. And mao to, pag ang bata na isakit, di sila makabuhat ana nga mga movements, mga activities, kay dili kaya silang lawas. Then there are some children who are sick experience stress in their daily lives. So may mga bata nga ma-stress sila pag naa sila sakit, and ma-depress sila, and remember that it is a child who is sick, not a sick child. Then the following that I discussed to you are the stress factors and ways to minimize the stress of infants and toddlers and preschoolers. Then, infants and toddlers. So, what are these? So, different milestones characterize each stage of infants 0 to 12 months, and toddlers 12 to 36 months development. So, the stress factors of infants and toddlers are very vulnerable to separation, limited mobility due to the procedure, changes in daily schedule and routine, unfamiliar people, places, and sounds, sensitive to excess stimulation. Then, ways to minimize this stress are to encourage parents to allow the patient to bring a comfort item. It is important to make the patient comfortable with the procedures. To talk to the patient in a calm and soothing voice at all times. To make the patient more comfortable, show a good posture and facial expression. It makes the patient afraid if our facial expression is not okay. And for example, I am the phlebotomist and I will collect blood from a child. To make the child not be afraid of the procedure, I will show a good facial expressions like being happy, to show the good facial expression, being happy, and provide as much TLC as possible. TLC means gives tender loving care to the patient. So we all know that the patient is kids. Then listen environmental stressors such as bright lights, noise, or cold. Support parents emotionally and prepare for the child's reaction. Next is preschoolers. A child of 3 or 4 is considered a preschooler. So whether or not the child is attending a formal preschool program, he is no longer a toddler. So the stress factors are separation anxiety and stranger anxiety. Egocentric. What is egocentric? It is unable to view others' thoughts, feelings, does not understand the reason for blood collection. So, fantasies and misconceptions about the equipment use. So, magical thinking creates fantasies and misconceptions about the equipment used by phlebotomists, like the needle or syringe. So, maglibog sila kung unsa to nga mga equipment. Then, limited understanding of body functions or procedures. Then, painful and frightening procedures. Then, the ways to minimize these stress factors are use restraint but a minimum. Prepare the patient for all procedures using medical play and equipment. Explain what is going to be done. It is important to explain the procedures to the patient, like preschoolers, patient, to make them ready and not surprised for the procedures. Use simple coping strategies. Reinforce the reason for treatment, hospitalization as not due to the child's behavior or action. Support parents emotionally and prepare for the child's reaction. So both infants and toddlers and preschoolers patients needs to know the procedure even though they will not respond to our explanations or the explanations of phlebotomies. It is important the proper care for the patients because phlebotomies is not only for collecting blood samples but to ensure the comfortable and health of the patients.
So, good day everyone. I'm going to discuss two short topics, and the first one is developmental reactions to pain. So, we have infants. Babies rely on a caregiver to notice pain by seeing the following signs, and those are restless, clingy, or whining, decreased activity, sleep more, lose interest in a favorite toy, increased frantic activity, loss of appetite, and lastly, difficult to console. So those are the signs for infants. For toddlers and preschoolers for 2 to 5 years, we have children ages 2 to 5 experience pain but cannot always pinpoint its source or location. At this age, reactions to pain can include the following, and those are belief that pain is a punishment. Secondly, belief in the magical disappearance of pain. Third is resistance during painful procedures, and lastly, require less practice with relaxation. So school age 6 to 12 years, school age children are able to locate pain in terms of body parts. Children ages 6 to 12 experience are the following reactions to pain. First, we have afraid their bodies will damaged or changed, feel injury related to guilt or deserve pain, and lastly, require more practice with relaxation. So those are the signs for developmental reactions to pain from infants to 2 to 5 years and 6 to 12 years. So for our second topic, we have managing pain. So how do they manage pain? We have one of the most direct methods to manage pain before a venipuncture is to use a tropical anesthetic to numb the site of the venipuncture. The first of we have lidocaine and prilocaine cream or Elamax. It can be applied to the skin in the location of the site to be punctured, and once the cream is applied, it takes about 30 minutes to fully numb the area, then proceed to blood extraction. Other tropical anesthetics available are Amitab, Smith and Nephew Healthcare, and 4% lidocaine, Ferndale Labs. It requires prescription and a nurse or physician to apply the cream, and the skin can be punctured and the child will feel little or no pain at all. And for younger children that requires a heel stick is we have the Sweet Ace. It's a sugar-coated pacifier that children can suck on for comfort. And lastly, the most effective analgesic effect while you do the heel stick is the breastfeeding. This will take the cooperation of the mother while holding the child so the food is accessible. And according to a study in 2009, there was a reduction in discomfort of 51% and crying by 98% with the infant. So that's it with that's all for my Rafael ikat ni diri nga part. So that's it for my
Hi, good morning. I am Trisha Nicole Bivillasor, and I will be discussing about the instruction and involvement of the child in the procedure. So first is distraction. It simply means getting the attention of the child for them to focus on something else or hindi sila matakot sa gagawing procedure ng isang phlebotomist. Well, distraction can be used instead of or in addition to the Elamax cream. Um, Elamax cream is used to prevent and control the pain during procedure. Well, there are many ways para i-distract ang mga bata. Pwedeng gumamit ng bubbles, flashlight, and books para i-block yung kanilang view na hindi nila makita kung ano yung gagawin sa kanila. So, distraction techniques always take several people. Like, kailangan maraming tao ang tutulong para magawa yung procedure. First is yung phlebotomist, yung magper-perform ng procedure. Next is ang hawak sa bata and ang parents na kung saan sila yung magdi-distract sa bata. That is why the presence of parents is important. Well, it says that distraction has been found to be more successful in calming a child during collection of a sample than the reassurance of the parent. Kasi kapag sinabi ng parents na, it's okay, don't worry, it's not painful, well, ano yung bata, yung parang iisipin niya na, ay meron talagang something na I should worry about. Parang ganon. So, mas maganda yung distraction kaysa sa reassurance ng parent. It's more like the children tend to show more fear with parental reassurance than with distraction. So, next is involve the child. So, the more na i-involve natin ang bata sa procedure or sa process, the more din na maiintindihan nila kung ano yung gagawin sa kanila and mas magko-cooperate sila sa phlebotomist. But before the phlebotomist do the procedure, kailangan tanungin muna ang bata if meron na siyang experience sa sa ganon. Like, ano yung na-feel nila before nung ginawa sa kanila yung procedure. Role-playing is makakatulong din siya para magawa yung procedure. Like, ano kasi, mas maiintindihan ng bata kung ano yung gagawin, ano yung mangyayari. Makukuha mo rin yung tiwala nila and it makes them comfortable sa phlebotomist. So, hindi na sila matatakot. Hayaan na lang nila yung phlebotomist kung anong gagawin. So, pero, of course, nandun pa rin yung sakit, nandun pa rin yung iiyak sila, but at least, hindi na sila masyadong gagalaw, diba? That is why, important din na i-involve yung parents sa mga ganong sitwasyon. Explain lang sa bata kung ano yung importance ng gagawin sa kanya, kung ano yung benefit na makukuha niya sa procedure.
Good afternoon, everyone. My name is Shara Montreal, and I will be discussing about the sample collection from an infant or pediatric patient. So, finger sticks and heel sticks are usually performed on infants or small children when the testing requirements are minimal. And these procedures are also done in situations where the adult patient has poor veins, especially our elderly patient who have fragile veins, or when the physician requested for finger stick or heel stick. So, the common tests usually performed by finger stick or heel stick on infants and children include neonatal screening for newborns. So, every newborns are tested for a group of health disorders that aren't otherwise found at birth. So, with a simple blood test, doctors can check for rare genetic, hormone-related, and metabolic conditions that can cause serious health problems. Second is to check for bilirubin. This is as well for newborns. So bilirubin is the yellow substance that our red blood cells produce when they are being broke down. So children with high level of bilirubin develop a disorder called jaundice. So their skin and their eyes appear to be yellowish because of high level of bilirubin. Third is to check for complete blood cell count or CBC and hemoglobin in hematocrit. So this is for all ages naman. So moving forward to the venipunctures. So venipuncture usually performed on older children. So there is no actually specific age to perform venipuncture, but the preferred age would be 1 year old to perform venipuncture over heel stick. So We also perform venipuncture to children na maraming laboratory tests ang nire-request sa kanya. So, venipuncture is performed in the same way on an infant or child as it is an adult. However, the difference is that the infant's or child's veins are smaller and have the tendency to collapse. So, we use smaller 2 to 3 ml evacuated tubes or a small syringe attached to a 23 gauge butterfly, which this gives less vacuum para maiwasan yung mga collapsing veins nila. So, the method of choice for children is the collection with a butterfly and 23 gauge needle. So, the test usually performed by venipuncture include routine coagulation studies when we test for prothrombin time, activated partial thromboplastin time, blood culture, lead level, which is more accurate if performed on venous blood than capillary blood, and tests that requires significant amount of blood such as allergy testing. So since maliit yung mga veins ng mga bata than those of an adult, mas mahirap talaga siyang hanapin. So we have devices that emit high intensity or infrared light which can be used to illuminate veins in both infants and adults. So first, we have the Venuscope 2 transilluminator. So this projects a high intensity cool light on the subcutaneous skin. The light causes the veins of the patient to contrast with surrounding tissue, which makes the vein visible and more easily accessed. The second, we have this figure, we have the neonatal transilluminator. This is used on the palm of the infant's hand para mag-illuminate yung veins niya in the back of their hand. So we also have infrared imaging. So these are the examples of infrared imaging. So this is an alternative to high intensity light. So infrared imaging shows the contrast between the veins and arteries and the surrounding tissue. So yung hemoglobin natin, sila yung nag-a-absorb ng infrared light. So the vessels containing blood will appear darker when the image is projected. So this image produces a roadmap of where the veins and arteries are, and this gives the phlebotomist an image kung saan niya dapat ipo-point yung needle when performing a venipuncture. So these are the example of the infrared imaging. So we have the glasses worn by the phlebotomist. So we also have the freestanding device and the AccuVein. It is a handheld device that uses near-infrared technology na magda-display ng position of the veins on the patient's skin para mas mabilis siyang malukit. So all of these devices are tools that direct the phlebotomist to the best location. So mas madali siya and mas convenient. However, the imaging technology cannot replace the phlebotomist's ability to feel for the vein. Kaya we are really taught to feel for the vein because not every clinics and hospital has these devices available.
Good day, everyone. My name is Maria Tricia Lawrence T. Vargas, and today I will be discussing about the dorsal hand vein blood collection. When the veins in the antecubital fossa are unsuitable, venipuncture may occasionally be done in the hand vein, where the blood is drawn from the pons dorsum or the backside of the hand. The phlebotomist should make sure that the skin is stretched and the vein is firmly anchored before inserting the needle because the veins in the hand have a tendency to roll. For newborns and infants less than 2 years old, dorsal hand vein blood collection is often preferred as an alternative for heel stick and finger stick. For the hand position, the patient's hand should be held slightly lower, with the top of the hand facing you when drawing blood from the hand vein. So the patient should form or make a relaxed fist, making the fingers roll underneath, and make the skin taut by gently pulling back on the skin surface with your thumb. For venipuncture to be successful, the vein must be sufficiently anchored. For the tourniquet position, always place the tourniquet 3 to 4 inches above the needle entry position. But for the dorsal hand vein blood collection, the tourniquet should be placed 1 to 2 inches above the wrist when looking for a suitable vein in the hand. To prevent hemoconcentration, the tourniquet should be removed after 1 minute and then reapply it before performing the venipuncture. The materials needed for the procedure are 23 or 25 gauge clear hub syringe needle, sterile gauze squares or cotton balls, alcohol pads with 70% isopropyl alcohol, gloves, micro collection containers, and biohazard sharps container. Now for the procedure. First, we need to perform hand hygiene and apply gloves before any patient contact. Next is identify the patient and verify the collection orders. We need to choose the hand with the most visible dorsal vein and select the appropriate micro collection containers and needle. For newborns and infants, you need to immobilize the child, having someone hold the child or with a blanket. Next is wrap your hand around the wrist with your thumb, holding the fingers of the patient in a fist or relaxed fist, and your index finger should be placed on top of the wrist. Next is applying enough pressure to enlarge the vein. For adults, tourniquet should be used and placed 1 to 2 inches above the wrist. Next is clean the site with alcohol pads and let it dry. Next is select the appropriately sized needle for the vein to be used. It's either 23 or 25 gauge needle. Next is wrap your hand around the child's wrist as was done in step 7, or wrapping your hand around the wrist with your thumb, holding the fingers of the patient in a relaxed fist, and your index finger must be placed on top of the wrist. Next is line up the needle with the selected vein and insert the needle at a 15-degree angle until blood fills the clear hub of the needle. And after that, we need to fill the microcollection tubes from the blood dripping from the needle hub and relax pressure on the child's wrist intermittently to allow additional blood flow. After all the microcollection containers have been collected, remove the needle and apply pressure to the site with a gauze square or cotton ball. Next is dispose the needle in the sharps container and seal the sample containers. The anticoagulant samples should be mixed 5 to 8 times and label the collection containers after. And after performing the procedure, we need to perform hand hygiene.
So hello everyone, I am Kyla Ruben M. Borgos and I'm going to talk about proper restraining techniques in handling pediatrics patients. So first, restraining the child is often necessary to avoid hurting the child while extracting the blood. So this is very important because some children tend to pull away if they feel pain in a certain part of their body. So if hindi mo talaga maiwasan na may pain talaga if we are extracting blood, but we should limit it so that or we can distract the child if we are going to extract blood from them to avoid this kind of situations, yung parang masyado silang magulo or di kaya magingay sila or mag-shout sila while we extract the blood from them. So immediately remove the needle when the child is able to break free to avoid injury. So this is very important kasi if sobrang malikot na yung bata because umiiwas na siya dun sa pain na na-feel niya while we are extracting the blood. So it is our first na kailangan gawin is to immediately i-remove natin yung needle para hindi na further problems or complications doon sa bata. So, if the phlebotomist is working alone, it is best to ask for assistance with other phlebotomists. So, if you think that you cannot handle the situation, you can reach out to other phlebotomists on your laboratory, but if we can tolerate or di kaya makaya natin na tayo lang mag-extract ng blood doon sa kid, so go for it. But if you feel like hindi mo masyado ma-handle yung patient, it is best to ask for assistance. So next, we aim for one extraction procedure. So this is very important kasi some patient, lalo na pag pediatrics, they tend to be very scared if madami tayong beses na magkuha sa kanila ng blood. So, one extraction procedure should be our main goal if we are handling pediatrics patients, to avoid traumatizing them from the pain as well as um, to the process of extracting blood from them. Next, let's talk about the techniques to properly hold the child while extraction. So, the patient should hold the child on his or her lap while holding the child's arm. This keeps the parent involved in care, the parents can see the procedure, and the parents' presence keep the child to be less afraid. So, yun nga no, so, nung mga bata pa tayo, ang presence talaga nung parent natin ang naga-comfort sa atin whenever we go to a certain area or a new place for us, especially the hospital. Kasi nga, there's this idea dati na if dalhin tayo sa hospital, something bad is going on, tapos turukan tayo ng mga 'di ba, ng mga injections. So, or ng mga syringe. So, it is very, na it is very crucial yung parang presence ng parent while we extract the blood kasi nga, they keep the child in place at the same time, they keep the child from wreaking havoc while we extract the blood from them. Next, another technique that we could use is a supine position, which you lay the child on his or her back, and the parent would hold the arm at the front of the child to keep it from um, moving. So this allows several people to approach the child. For instance, yung child natin na patient is kailangan ng ng kailangan ma-extractan ng maraming dugo, tapos hindi siya makuhanan sa particular area. So it is best na open yung parang mga site nung puncture or yung parang kuhanan natin ng dugo kasi nga hindi mo agad makokontrol yung bata, like sabihan mo siya na maghiga siya sa ganito, hindi agad yan siya magsunod kasi nga matakot siya sa lugar, matakot siya sa madaming tao, matakot siya dun sa situation niya. So, supine position is nag-provide ng parang support yung parent pag nag-extract si phlebotomist. So, next we have this pappus board that we use to restrain the child. The body of the child is restrained by the bands. A blanket is wrapped. Could also be a alternative, but usually traumatic and treated as the last resort. So these two techniques can be used, but sometimes it is tend to be the last resort in managing those pediatric patients, kasi nga if hindi nila ma-feel yung presence ng parent sa isang lugar, they tend to be very scared, sige sila ng iyak. So hindi na siya masyado mahihirapan si phlebotomist na magkuha ng blood doon sa child kasi nga hindi na masyado nang erratic yung child. So if ganun yung mangyari, we should avoid separating the child from its parents, so we need to keep the parents involved, ask the parents from assistance in extracting the blood para mas mapadali yung parang procedure natin when it comes to extracting the blood. So next is patients who are resistant and difficult. So usually, older children tend to be more resistant if they are already aware to what is about to happen. So, they tend to fight the phlebotomist and the parents if hindi nila gusto magpa-extract ng blood. The phlebotomist cannot force a child to undergo with the process. So, yung parang mangyari dito sa mga patients who are very resistant and difficult na kuhanan ng dugo is one, may trauma sila kasi nga baka yung past na experience niya sa extraction ng blood is parang masyadong matagal, grabe yung pain na naano niya. So, we need to have a longer patience with those type of patient kasi nga hindi nila na kokontrol pa yung emotion nila kasi nga mga bata pa. We need to go for an extra mile to keep them secure, to assure them that there is pain, but we can tolerate those pain. And we need to also address the the issue, or di kaya you need to explain the procedure that you will going to um, do to the patient kahit na bata siya. You need to still um, indicate ano yung gawin mo na procedure sa kanya. At the same time, you can talk to the parent like ganito yung procedure, ganito yung mga kukuhanin natin na sample sa kanya, ganyan. So, tips to effectively work with children and families. So, number one, smile and be friendly. Keep a calm voice. So, napapansin ko usually pag nasa hospital, yung mga nag-extract ng blood sa akin kasi they have this very kind voice that hindi ako masyado nagpapanik whenever someone would extract something from my arm. Tapos pag magkasakit ako, ganyan, hindi na siya masyado hindi na siya masyado very, um, parang hindi ka mag-panic kasi nga there's this assurance sa kanilang voice na they would help you, that they would handle it, ganyan. So, that is something that we also need to emit whenever we face our own patients, especially kids. So, introduce yourself. So, it is very important that we introduce ourselves and be very mindful of our facial expressions kasi nga kids do tend to focus more on the facial expression of an individual who would approach them. So, if masyadong matara yung face mo, baka intimidate yung kid and mag-shy away siya sa iyo and mahirapan ka mag-extract ng blood sa kanya kasi nga yung parang fear nung bata, yung parang intimidation nung bata is doon na yung yung parang mindset niya. So you have to smile to them, have this friendly voice, approach them, slowly approach them kasi hindi yung takbo ka agad sa kanila. You need to slowly approach them to um, make them feel na hindi ka threat sa safety nila. Next, you have to stoop down to the child's height when talking to them. So, yun nga, sabi ko, if you are standing above them, or 'di ba kasi mas matanggal naman talaga tayo kaysa sa mga kids. So, if magtingin tayo sa kanila sa baba, standing on our own height, baka ma-intimidate sila sa ganon. So, whenever we are talking to our patient who is a pediatric patient, we need to squat down tapos mag-level tayo sa height nila whenever we are talking to them. Kasi they would feel that we are equal on the conversation. They would not feel intimidated and they would baka mag-open up sa'yo agad. Next, we have to include personal conversation. So, magtanong ka sa kanya ano yung mga favorite color niya, ano yung favorite hero niya, yung mga ganun, like, anong favorite niya na mga show, just to engage in a friendly conversation with the patient. That would also help them to open up to you and they would feel secure they would feel secure in the situation that they are already in. Use simple words and phrases. So, hindi tayo masyadong magamit ng mga very difficult na mga jargons, kasi nga, ang ating patients is mostly mga kids. So, parang explain mo sa kanila, like, magkuha ako ng blood sa'yo ha, ganyan. Tapos, yung blood na yun, gamitin natin para ma-treat natin yung illness mo. Tapos, you would go, okay na, tapos ganyan. So, you use your very simple words in talking to them. Sa parents din, ganun din yung gawin natin. We don't have to complicate anything to them kasi nga, kailangan lang natin i-assure sila na i-assure natin sila at the same time, i-explain natin yung procedure na gagawin natin sa kid nila. Next, use distraction. This is important kasi nga, pag ma-distract yung kid, hindi sila masyado nakaka-focus dun sa area na parang we desire to, to get, for instance, ng mga bata pa tayo, pag-injectionan tayo ng mga vaccines, hindi natin napapansin agad kasi nga, we tend to focus more on the other things rather than yung parang nakikita natin yung needle na papasok sa mga kamay natin. So, anything na makadistract sa kanila would help the phlebotomist to do his or her job in extracting the blood from the patient. Next is avoid complex conversation. So yun nga, as I've said, use simple words and phrases. Hindi mo kailangan i-complicate lahat. You just have to explain it to them kung ano yung gagawin mo and the procedure na gagawin mo to mas mapadali yung parang pagkuha natin ng blood sa kanila while decreasing or reducing yung amount ng pain na ma-feel niya while we extract the blood from them. Next is be honest about the pain. So, yun nga, sabi ko, hindi natin pwede sabihin na wala talagang pain kasi nga may pain talaga if we are going to prick the the puncture site like the palms or kaya yung mga soles ng feet, there is really pain kasi nga even if we are adult na tapos kuhanan tayo ng blood, di ba? There is still pain, but we need to make them understand na merong pain but it is something that we can tolerate and mag-go away din siya after. Next is avoid separating the parent and the child. So, nasabi ko nga kanina, for kids, the safest place or the safest person that they could be with while undergoing such procedure is their parents. So, we must avoid separating them or di kaya kahit na ilayo lang natin, kahit na mga few centimeters lang, we should avoid that. We can ask the parents though to hold the child to hasten our procedure in extracting the blood kasi nga they could assist us in holding the child para hindi sila masyado squirmy when we extract the blood from them. Next is give genuine compliments and encouragement to the children. So this is very important kasi nga minsan pag bata pa tayo, 'di ba, maniwala tayo kahit anong sabihin ng mga matatanda sa atin like parang you are seeking validation sa kanila like you did good o if may mga nagawa ka bang kasalanan ganyan, the facial expression of the adult would show it. So, kailangan natin maging genuine whenever we compliment the child. Hindi yung parang nag-compliment ka nga sa kanya na good boy tapos grumpy face ka naman. So, whenever we compliment them, we should also make sure that our face equal those compliments that we are saying to them. So, a simple smile or a pat in the back to assure them that they have been a huge help in extracting the blood or in finishing the procedure that is needed to be done to them. Next and lastly, that is to continue to be patient even when the child is least lovable. So, hindi talaga natin maiwasan na there is some patients na very talaga maldita or di kaya hindi natin ma-handle yung mga attitude nila, but we should be the bigger person and be patient with them. Basta makakuha lang tayo ng blood sa kanila so we can do our job. And that is to help them in acquiring the health care that they needed. So that is my report. Thank you for listening.